Hello, Dick Lindstrom here from Minneapolis. Welcome to this webcast hosted by OWL, Advancing Diversity in Leadership. I'd like to begin by expressing OWL's thanks to Pentavision for sponsoring tonight's webcast. In addition to OWL's partners, Alcon, Allergan, Bausch & Lomb, J&J Vision, Novartis, Star Surgical, and Zeiss for their ongoing support. For those of you who are not familiar with OWL, those initials stand for Ophthalmic World Leaders. OWL's mission is to provide professional and personal development and create opportunities for collaboration. And their ultimate vision is to promote and develop diverse leadership to advance ophthalmic innovation and patient care. If you're not already a member, I would highly encourage you to join. OWL is a 501c3 nonprofit and is the only organization that works across ophthalmology, uniting all stakeholders. It's therefore fitting that this evening's webinar will address how industry and doctors are collaborating in these challenging times. So along with me, I have 5 other panelists, and I'm going to start by asking them to introduce themselves and tell us a little bit about their current situation. So Jay, why don't you start with you?
Great. Good evening, everyone. My name is Jay Perec. I'm Chief Medical Officer for Eye Care at Allergan. And like the rest of the world, we're guarded about the situation, but hopefully there's a light at the end of the tunnel.
And we have another industry participant, Shondo Puffey.
Thank you, Shondo Puffey, Johnson & Johnson Surgical Vision, VP of Americas Businesses. I've had the fortune and the interesting coincidence that I was appointed exactly the same week as our governor in California put a shelter in place. So I've been learning our customers and business from my home office for the last 2 months, and it's been amazing to talk to a lot of you and a lot of our people as well. So pleasure to be here.
And we have one practice administrator, Matt Jensen.
Hi, everyone. Thanks for having me. It's an honor to be here. I'm the CEO of Vance Thompson Vision in Sioux Falls, South Dakota, and we've got clinics and surgery centers in Montana, North Dakota, Nebraska, and Minnesota, and also have a small communications firm that works with industry and practices. And I believe across that group of experiences, we have experienced some neat things over the last 5 weeks that are interesting to share with the whole. So thanks for having me.
And then to the East Coast, Dr. Rene Preval.
Hi, everyone. My name is Rene Preval. I'm in solo private practice in Glendale, Maryland with Envision Eye and Laser, and I'm also Director of Cornea at Howard University Hospital in Washington, D.C. So I work with the residents there.
And then to the West Coast, Dr. Audrey Rostov.
Hi, everybody. Nice to be here. I have a large multi-specialty private practice. I'm Director of Cornea, Cataract, and Refractive Surgery. We have 8 offices and 4 surgery centers and are based in the Seattle and Puget Sound area. It's now my pleasure to introduce Dr. Dick Lindstrom, who will be moderating this evening's program. Dick is an international household name. He is the founder and attending surgeon at Minnesota Eye Consultants and an internationally recognized leader in corneal cataract and refractive surgery. His professional affiliations are extensive. They are too numerous to count. He has over 40 patents and hundreds of publications. He currently serves as adjunct clinical professor emeritus at University of Minnesota and visiting professor at UC Irvine Gavin Herbert Eye Institute. He's been at the forefront of ophthalmology's evolutionary changes throughout his career as a recognized researcher, teacher, inventor, writer, lecturer, and of course, highly acclaimed physician and surgeon. I had the privilege of doing my fellowship with Dick and appreciate and I'm honored to have him as both a mentor and a lifelong friend. We are thrilled that Dick is such a good friend to OWL. In fact, his wife Jackie was one of the founding members of OWL and introduced me to OWL as well, took me to my first meeting, and that he has agreed to moderate this evening's panel discussion. So thank you.
All right. Well, thank you. So this all started mid to late March, and we've now done a whole month. Some of us have, actual numbers to share. At Minnesota Eye Consultants, we are an integrated practice, MD-OD, and we never completely shut down. We continued to see emergencies and then transitioned to what we would call urgencies. Both our clinic and ASCs, did stay open. If we look at our volume in the clinic, including telehealth, which we definitely bumped up, we maybe saw 15% of the patients that we would have seen in the previous year in April. And in the OR, we did about 5% of the number of cases that we would have done in April. And so we are starting to expand now going into May, and our governor has told us that starting next week, we can actually do elective surgery. We have started to do earlier, this month, some urgencies, which I think are a little more aggressive than emergencies. But next month we'll go back into doing more, and we'll talk more about what that means and how we're going to manage that. But we are starting to expand. So, what was April like for you, doctors? So let's talk to Jay and Audrey and Rene and then Matt. So Jay, what was April like in your clinic?
Well, at the company, obviously, I think everyone, when the virus first hit, some of us may have thought it was going to last for a couple of days, couple of weeks. Obviously, many weeks later, we know for a fact that there's a good chance this may, be around for the rest of the year. And quite frankly, at Allergan, we did what was right for our customers, our physicians, as well as our own employees. And we pretty much went to work from home just to mitigate the burden of travel and really trying to be commensurate with social distancing. So for the most part, it is business as usual operationally. We need to make sure our products get into the hands of our customers and our patients. So supply chain for sure is there to supply drugs that have been well known now for the last several years. But in terms of the reps, directors, the sales force, MSLs on medical affairs, everyone's been pretty much working from home, trying to engage in a digital fashion, which seems to be one of the things that have really come about through this dilemma that we're in. I think the way we all engage our customers in a digital way is something that the science of digital medicine will continue as time goes on. So it's business as usual, but engaging people in a different way.
Let's stay with industry then, and then we'll work our way across the country from west to east. But Shondo, what's it like at J&J Vision in Irvine? Is people going to work or staying home, or what's it like?
Thank you for the question. And first of all, I'll just say I completely agree with Jay that our supply chain and manufacturing people have been kind of like the unsung heroes in this in the organization, because they have been going in every day, following some social distancing and some proper safety guidelines, but really trying to produce the equipment, the IOLs, and everything that is needed for surgeries for the future as well. So that has been really great to see. As for our business in Santana, right, we have pretty much, like, I would say middle of March, we have also completely stopped going to the offices, and all of us are in our home office, and I think it's week 8 or 9 now in our home offices, which been a very interesting and great experience, because certainly you get to spend a lot more time with customers and with our people. There has been some great different webinars or training opportunities, right, that we have had for our field teams and for our customers as well. So it's been a very different experience. And in some way, it was also great to see for our people. And I think last week it was a panel that I dialed in and got some great ideas from a couple of the surgery centers owners and practice owners like you are, that how you engage your teams as well, right, over these weeks and months. Like, with journal clubs, with some of them with trivia questions and discussions and games, but really how you almost trying to keep people engaged, right, throughout this process and make sure that as we come out of this, we really feel stronger as a team and we are well engaged with our communities and with our customers. So we've been trying to do our best, at the same time really staying home. And I think as some of the limitation and restrictions will start easing up a little bit, we'll have certain guidelines how we slowly go back, hopefully to a new norm rather than the old norm.
That's great. So Audrey, let's work our way across the country here. So you were right in the center of the storm to start. So what was April like for you, and what are you hoping for in May and June?
Well, we also never closed our offices and ASC completely. We were available and are available for urgent and essential patients. Our clinic volume is about 15 to 20% of what it normally is, and that was throughout March and April. We are now, the shelter in place is still in place here in Washington State until the end of May. However, we are going to be able to start to do more surgeries starting in 2 weeks, week of May 18th. Our volume is going to be about 50%. And what we also did is we actually mapped out our waiting room to decide how many chairs would be appropriate for social distancing, also having family members and patients wait in their cars until they're called, be brought directly into exam rooms. We've instituted a whole new SOP with hand hygiene, cleaning of rooms, just, everybody wearing masks, requiring patients to wear masks. And so we've seen, tremendous drop in volume, obviously, as we needed to, but are hoping to ramp up to about I'd say 50 to 60% or almost 75% maybe in clinic with extended hours and 50% in our ORs.
So you furloughed a lot of patients, a lot of employees, just like we did, and now you're starting to bring them back. Educational process.
Yeah, we've had to furlough 85% of our employees, and the partners still haven't. We're still not getting paid. We were the people going in to see the patients. Everyone else, fortunately, Washington has generous unemployment benefits. We wanted to maintain employee benefits by furloughing them rather than laying them off. And so that they would be okay, which was really being able to care for patients and take care of our employees were number one. And two, wanted to be sure our employees were well cared for. While they were on furlough, we had a lot of them do more continuing education, like our technicians, for example. Some of the technicians, my refractive surgery coordinator, for example, did some virtual smile and refractive surgery consults, and so that was helpful. We also had some customer service training, and so really tried to take advantage to be able to do a lot of those things that they were going to do, but never had a chance to. So in that way, it's a positive, able to do all the things that you always talk about that you want to do, and now we have the time.
So Matt, middle of the country, your experience was, although you had a pretty good bolus of COVID cases there with your meatpacking plants and the like, but I don't believe you furloughed any employees. You managed things a little bit differently. Tell us what you did. Another large practice, but you managed things a little differently, I think.
Yeah, well, thank you, Dr. Lindstrom. And we did furlough a few, especially our part-time employees, those who were in school or other things. We found that by supplementing their benefits and then allowing them to get some state-funded support, they could actually sit in a lot better position than if they were just working part-time throughout that time period. And so it ended up being to their credit during this time to be furloughed. Everyone else we kept on, and we had everybody take some haircuts financially, so we'd all be in this together. The higher you get in the organization, the larger the haircut. And I'll just mention I'm bald. So, but I think that more than anything, we just communicated with our team almost daily. 3 or 4 times a week, we have a video call with everyone involved, like this one, or we're sending a video out, just an iPhone video to our team members, telling them what we know, what we don't know, the problems that are still stumping us. Like you, Dick, we've had probably 10 to 15% in the clinic, 5% in the surgery centers, and all of those being urgent or emergent cases. And I agree with Sandor that a lot of our unsung heroes are the folks who kept coming in and day out, despite where the pandemic was in our markets. Now, a lot of people don't look at the Midwest as being a COVID hotspot. Sioux Falls was the hotspot in the country for 2 of the last 4 weeks because of the proximity of how people work in our meat packing industry, and it's been the center of a lot of national attention now. And so as a community, we're dealing with those things, but our protocols are very similar to all of yours, but it's helped us to re-engineer what we think, rethink what exactly do we need before the doctor sees the patient. And we've been able to, keep that on the burner and boil it all the way down to, what we call the MVP, the minimum viable product. It's the base information we need to have a good interaction with the doctor, and let's get only that so we can have the least amount of exposure as possible. And done some neat things with staggered scheduling to keep certain clinics only, going, and then their clinic rests for a few days. And we've tried a number of different things, and I think that they all work pretty well. I think mostly it was a good encouragement to the team to let them see that we were serious about keeping them safe as well. And for the last 2 weeks, we've all been opening up our schedule to a little bit more of an open degree. We opened up about half volume and filled a lot of it. And this next week, we're just going back to our original clinic and surgery center volumes with some precautions in place for safety. But we're doing that because we want to get a sense of the market, like where is reality right now. In the first couple of weeks, we anticipate there will continue to be a little bit of a spike because of how we've put people off during this time. But we're really wanting to get a sense of, what is the new reality we're all facing. And we're doing that while talking to our team every day and getting, feedback from the front, so to speak. We think that the most powerful feedback we can get is from those who are doing the work. So that's a little bit of how things have changed over time. We continue to believe that the most important thing we can do is communicate to our teams. That they, like our patients, have a high amount of anxiety, but if we can get them clear answers, they will turn around and see our patients with calm and clarity and have it be a good experience still. So that's been a real priority for us.
So, Dr. Preval, you're in solo practice. The others of us on the group are in big groups. So what's that been like? So tell us a little bit about those special challenges.
Yes, definitely has been challenging. About 2/3 of my staff decided that they did want to take advantage of what was available to the state, and the remainder said they didn't. They could kind of, as long as I made sure they were okay, if they needed benefits or anything like that, they were okay with not receiving state benefits. And that was, I thought, very, very good. I have been coming in and working on administrative issues. My administrator also came in working on old billing, collecting outstanding payments, not from patients, but from insurance companies. And April it's definitely been challenging. I've seen less than a handful of patients in person, but quite a few patients by telemedicine. And I think that telemedicine has really been great because it lets the patients know that you're available. The patients in Maryland, I think we're a bit more of a hot spot. I don't get the sense that they want to come in, but they like knowing that I'm available. They're able to get their medications. They're able just to even hear my voice or hear my technician's voice. I have had technicians who have been able to help answer the phones remotely, call in prescriptions, and I think that puts the patients at ease. One thing that I have appreciated is the support from industry. I've had my pharmaceutical reps reach out to me to let me know what kind of programs they've instituted for patients to be able to receive medications now. So that's been extremely, extremely helpful. And I'm working on my operating procedures, updating those, working on getting my office ready, installing plexiglass around the front desk to make sure that that area is sealed off. I've taken care of the slit lamp areas. So I'm just working on that. I want to also work on making sure OSHA is updated. I think that's something that's going to be important. And I think it's going to be important when I bring people back to make sure we have a webinar, we have a PowerPoint maybe so everyone understands that we're all on the same page. Here I operate both in DC and in Maryland. So Maryland is not open yet for non-elective surgery, and neither is Howard University for non-elective surgery. But that being said, I have gone in for emergency cases at Howard, open globes, and that's been really interesting and challenging, but okay. So I feel like we're holding the course, just waiting till we can open up fully, but I feel that I'll be ready once we get the go ahead.
So to Shandor and Jay, so we're starting to go back to work. We clinicians are starting to go back to work this next month, and we expect to be even busier in June. So when we call J&J or Allergan, is someone going to answer the phone? And are you ready for us basically to go back to work? Is your team going back to work if we're going back to work?
Dick, that's a great question. So I think the going back to work phenomenon is going to be slow and gradual and measured. And just like you're doing your practices, we'll be doing the exact same thing here at Allergan and across the industry. We truly care about our customers and making sure that the communication line continues. So when you've been calling us, we've been answering the phone day in, day out the last several weeks.
Mm-hmm.
We've been there to hold the hands of our customers as we're going through some really challenging times. On a systemic level, the Allergan Foundation has given several $1 million to fight the cause against COVID. On the patient level, as Rene said, we've had a mitigation of cost burden programs to help lessen the copay for our patients that are going through some tough, challenging economic times, and that'll continue. On the physician level, we have embarked, like everyone else has, on education regarding Zoominars and webinars and different ways of engaging our customers educationally, scientifically, in lieu of having some of the great meetings that we have at Ascaris and the other societies. And then last and not least, cash flow is an issue, as Audrey and Dick and Rene, you've mentioned, and we've extended payment terms for eye care providers to help with the cash flow burden and extend it, many months. So that'll continue as time goes on. This is not a turn on, turn off switch. It's going to be gradual. We're all going to hit the summer. And if they're true in, true out is a situation in the fall where there's a second coming of the virus or the flu season picks up, we could be in this again. Hopefully better prepared as a country and as industry and as it relates to our patients and our customers. So we will continue answering the phone day in, day out, but the digital means that we're all going through right now is something we will continue to explore and to invest in, not even this year, but beyond this year.
Andrew?
Yeah, to add to that, I think the good thing that came out of this unfortunate pandemic is that you have seen both the industry and as well as all of you as surgeons amazingly pivoting right away to the digital means. And it was amazing to see the telemedicine coming up so quickly, which I really hope that for our patients, we will continue to invest more and more into it right for the future as well. I quickly see that even our customer service, right? 100 people was picked up from one day being in an office, the next day being at home and working from home. And we're providing them the equipment, the headphones, the computers, and whatever is needed to make sure that we can continue to service the customers and the patients around the world. So there were, meanwhile, it came to an epidemic, but it was great to see how quickly some of these things can happen. And I think that creativity or innovation and initiative should remain there for the future as well. As directly from a customer standpoint, we kind of bucketed it to two different steps. Step one was when we went into this whole epidemic, which was fairly sudden for all of us, and certainly the shutdown of the clinics, of the surgery centers have impacted all of you. And we really tried to put together a couple of different programs, whether it's the payment term extension that Jay has mentioned already. We deferred actually quite a lot of our rental fees, leasing fees. We have extended expiring sales contracts, so there hasn't been any sort of compliance or any sort of other issues, right, that would hit you. So we really stopped or extended or deferred a lot of those payments by months, 3 months, a quarter, to make sure that there is no immediate problem for any of the facilities that have been shut down. So that was like the first program, and then we had fortunately a little bit more time to think about the second part, which is now you coming back to work. What are the different things that we need to do coming back to work in terms of as you start up, you will still be a little bit behind cash flow. What are the payment terms or kind of like a buy now, pay later terms that we can put in place to make sure that you can start up your practice, you can continue to generate revenue, and then you will have the ability to later on pay for it, pay for the products. Also, we look at it very much from a patient standpoint. Are there ways that we can look at some financing options that we can help? So there are some of these initiatives that we are currently implementing as we speak, to make sure that as you come back to work, we are there, and you have a number to call and we can help you.
So let's talk with clinicians, and maybe we'll go in the opposite order this time. So a patient comes to your office or is going to come to your office in May. How do you manage it? And for example, in our clinic, a person brings a patient in, everyone, they're required to have a mask on. They meet someone in the lobby who has a mask on. The accompanying person is encouraged to go back to their car and wait in the car. If that's not possible, they are allowed one person per patient to come along, and they're queried about healthcare issues, actually in person, not on the phone before, when it might be better. And we'll hear what Matt says here about possibly doing some of this on the phone before. We check their temperatures, they get a sticker, and then they can go into the inner sanctum, if you will, which would be the clinic waiting area or ambulatory surgery center waiting area. Those of us that used to see 6 patients an hour are now allowed to see 3 patients an hour. So we're required to go much slower. There's a lot of cleaning in between. So as a clinician, if I think about that, if I want to have the same volume of patients, I'm going to have to work 16 hours a day because it's going to happen a lot slower. And I'm going to be sitting on my hands, a lot because it doesn't take me that long to see the patients, right? But there's a lot of, getting ready, and only so many people can be in the waiting room. So that's going to be a new experience. And the same thing in the ORs, the turnover time in number of cases being scheduled, at least in our center, is about at a 50% pace. And so much slower than before. So Rene, when you open up, what's it going to be like for someone to come into your office?
Yeah, it's going to be very different, and we're going to start at about the same speed, 3 patients an hour. That's due for 2 reasons. One, switching EMR systems. So this actually kind of worked out. I have to slow down anyway, so it'll be okay. And also, of course, because of COVID. I'm also looking into telemedicine, continuing that. I think a lot of patients are really going to be nervous to come in. I don't see us opening in May. I think it's going to be closer to June. Here in Maryland, DC area, our numbers are still climbing, so we have to be very careful. But I think I'm going to really rely on telemedicine, especially for maybe not the new patients, but for return visits. And for the patients that I'm not so worried about with their intraocular pressures. Of course, the glaucoma patients have to come in, but maybe some of the dry eye patients, maybe some of the chalazions, the blepharitis patients that I can talk to, maybe look at, see how they're doing, and rely on telemedicine for that. I've also noticed I have a number of patients who are starting to call. They want to come in now. They want their refractions, their contact lenses, all those sort of things. So that's a little bit difficult right now, telling them that I don't want to say not allowed, but that we're only seeing urgent and emergent patients right now. The other issue has been making sure that the patients that do come, that we see on the phone or see by telemedicine, get their medications. So we've been making sure that we write for the 90 days. Some of the insurance companies are allowing for 90 days to be given all at once, which is great. With the co-pays, a lot of the co-pays being waived, that's been great. So I think it's time, I don't want to say to stock up, because there's always where everybody's stocking up on everything, but it's a good time now for the patients to get their medication. So later on, if they're having problems, they at least have some. So that's been very helpful for us.
Which telehealth program do you like? Do you have one that you favor?
Yes, I'm actually using Dr. First Backline right now. And then once I open up, I'm going to move to GlobeCheck. And you may remember them. They've been at the Academy, and I think that's going to be a great platform to help, because it's going to allow us to get almost all of the diagnostics that we need outside the office. It'll be a lot quicker than having patients come in the office, and then I'll be able to move forward and do a telemedicine visit with them after. So I'm very excited about that.
Yeah, we've been using DoxyMe, but let's have Matt. You have some plans, I know, to incorporate more work from home, from the office to home before the patient comes in, and in your future. What's this going to look like when you open again? To more patients.
One of the luxuries we have in a time like this is that it forces everybody to think differently about their work. And we don't ever want to let a perfectly good crisis go to waste. And so we've been challenging ourselves to ask questions about, bilateral cataract surgery and physicals before cataract surgery. And, do people really have to have 3 visits to get through all of their visits, meaning their physical, their first eye, and their second eye, and the exposure that creates along the way, when perhaps they could be seen earlier by somebody on staff who, is accredited to do so. I won't kind of let the cat out of the bag as far as what we're adopting and what we're not yet, because we're not sure, but we're asking all those questions. There's no sacred questions that we can't ask at this time. And that's just for efficiency and for the sake of the safety for our patients and our team. And I already mentioned it, but we've really called out in our minds, what are the things that have to be done on site and what things don't have to be done on site. And for those of you who have seen our center, it's neat, it's big, and it's too small already after, just being in there a few years. Before the pandemic, we were trying to figure out how we were going to expand or purchase more land or get more parking for patients and team adjacent to us. And overnight, our billing office and finance team is working from home, and happily, and perhaps more efficiently, and perhaps even more joyfully. So it begs the question of, what are our normals that we can call into question right now? Same thing with our counselors. How much of that information has to be done from their desk at work when what they're doing is really walking them through animations and doing education anyway? So can that be done from a different location? And so I think the biggest answer to your question, Dick, is just that nothing is sacred. And so on the back side of this, we believe that as much as can be automated should be, without sacrificing any of the customer experience that we feel like we've become known for. And that's kind of there's a balance there where one outweighs the other. And so we need to make sure we thread the needle properly. But those are all the things we're trying to challenge ourselves with, and why we think we're going to look differently coming out of it. By the way,
we've certainly learned we can do a lot more on Zoom and from a distance, and even taking a patient's history and chief complaint and social history. A lot of that can be done, in advance, probably while they're at home, counseling and the like. They don't all have to be in the office for 4 hours like many of us are used to in the past. So,
one of the mantras we've been, there's 2 books we've been challenging our leaders to read. One is Infinite Game and one is Unfragile. And very quickly, unfragile just means that fragile is when if you hit it more, it breaks. The more you hit it, the more easily it breaks. And unfragile isn't that it gets stronger. Unfragile is the more you hit it, the stronger it gets, not the more you hit it, that it stays the same. And so change management is the more change we go through like this, our teams actually get stronger through this. And we've been seeing that as a real opportunity by delegating our team to ask hard questions during this time.
So Audrey, how are you going to expand? How's it going to work in Northwest I?
Well, pretty similar to what you're doing, Dick, in terms of the number of patients that are seen and all of that. It just so happens that we're actually, for our main office in Seattle, we have plans to physically move towards the end of this year, and we're still going through with that, opening up a new office and surgery center. And this has really given us a nice challenge to look at that and look at it differently, sort of the ultimate in who moved my eye exam, as it were, and talk about the patient experience and doing whatever we can beforehand through telehealth to try to get their history, their medications, also for what they can expect for the visit, which I think is also helpful, give them an introduction to the practice, and then have them in the practice itself for necessary testing, exam, but the minimum amount of time possible, with also helping them feel comfortable and safe. I think as we are entering back into this new COVID-19 or post-COVID-19 arena, we really have to help make patients feel safe. And I think that that's one of the challenges that we all face, is how can we let patients feel safe, want to come to the office, not be concerned about having their exam or having their surgery, and to provide the best experience for them. And it's a work in progress, right? We're all learning every day and seeing what works and what doesn't.
So Shondo, we'll start with you and then to Jay. And as an aside for all the listeners, we're going to have a Q&A here in about 5 minutes, and you can type questions in even starting now if you'd like. But so when will we see a J&J Vision rep in our office again? When will you put your team in an airplane to fly to Minneapolis to visit with our surgeons? Same thing for you, Jay. When will we see an Allergan rep in the office? Will we ever see an Allergan rep in the office again? Will they be wearing a mask? Will we let them in, perhaps from the doctor perspective? But have you thought that through at all? So, Sandra?
I think it's an outstanding question, because again, just listening to you even right now, and we have been thinking about what does that mean that you're moving into more of a digital means with your patients. Obviously, we want to make sure that the patients, when they come in, they feel safe. So there are not so many people that are around. There are no reps maybe in the waiting room or waiting for bringing in something. Actually, on one of the other panels, someone mentioned that I'd rather have your reps doing a digital in-service or a digital product presentation than bringing in a launch, because they will just increase the kind of like the temptation for people taking their mask off and having a launch. So I would rather have you do things digitally, which I thought was a great point of, yes, we need to think about that of how we will do maybe some of the product introductions, some of the critical things around educations more in a digital fashion. At the same time, when it's needed, right, and even throughout the last 8 weeks, if there was a technical service need or a machine was down, our people were going there. They obviously, we ensure them to have the right protective equipment. At this point, more and more corporations or health corporations are requiring a test, a COVID-19 test. So we're obviously ensuring that for our people as well. So we are doing everything we can to comply either with the local state or the local facility or the local health corporation regulations to make sure that they can be let in. And in case it's patient critical, then they can travel and they can access your facility if you want them to. But at the end, their safety, so our people's safety, your safety, and patient safety is the most critical items, and that's what we are gearing up right now. And again, we're not going to force anyone, right, to go and to say, well, you have to go to the facility. If you feel comfortable and they feel comfortable, then we'll give them the right protective equipment and they can access your facility at your timing.
Okay, what are your thoughts on that? So
Yeah, so Dick, just like Sandor said, I mean, we have to be very slow and very, very moderate in how we think about this as we ease back into the commerce of touching your customers. There's no doubt in eye care, whether ophthalmology or optometry, touching customers at meetings, in the lunchrooms, with the technicians is very, very important part of our business, whether in the office or in the operating room. So it's going to have to be very, very deliberate, very commensurate with the local governments and what societies have told people on how they should engage humanity and humans. So, you know, we need to make sure our reps and our MSLs have personal protection. We need to make sure that we take care of them first, so then we can help take care of you. And I think the future is a hybrid of touch and digital. And we're gonna have to find that nexus, that perfect equilibrium to really make sure that our customers are never alone and that our patients are never stranded. So we'll know more in a month's time. If we do another webinar in a month or 6 weeks, it will be in a different time point. Hopefully this gets better. There is a lot of variance across the country. Rene talked about DC, New York, New Jersey, Connecticut, Pennsylvania are going through a different time point than you may be, Dick, in Minnesota and different parts of the country. So we respect what the societies are doing, academies doing. We respect the local governors, governance, local bodies. That's very, very important because we have to do that to be consistent with what is happening in real terms. How we engage, we're looking forward to getting those Allergan reps back into your office, Dick, and to Audrey's office and Renee's office with the MSLs and the scientific communication. It's very, very important. So we are bullish about it, but we're incredibly guarded, and it's truly a wait and watch to see what happens every couple of weeks.
so we're about to have our
Can I
first.
say something?
Sure, go ahead, Renee. Yep.
Before we get to the question, what I have really appreciated during this time is that I have found, actually, I've had more time to engage with the MSLs, engage with the reps, and my staff has as well. So I feel like I've taken advantage of this time, and it's been very, very helpful.
It's definitely available virtually, so that's a positive. And we're about to experience our first big virtual meeting with the ASCRS meeting coming up on May 16, 17. I just, did a virtual course, which was a new experience for me this morning, recording with Freeman, and I've got a few free papers to do as well. So that's going to be an interesting first to have whatever, 2 8-hour days of a virtual ASCRS. I think it's going to be, they're working hard to make it good. It'll be a first amazing experience, and hopefully we'll have a real academy in Las Vegas. And so I'm expecting that would definitely take place. So we'll see. Well, let's if we can, take a few questions here over the next 10 to 12 minutes. And if you have a question, type it in on the box, and we'll have our team pass it along to us.
Right. Yeah, thank you. So we've got some great questions in here. One from Ryan. He just says he appreciates everybody's insight on what you as physicians are doing on the front lines. His question is, what would you like the reps to do differently going forward? Would you prefer scheduled appointments as opposed to drop-ins? Would you want them wearing scrubs as opposed to business attires? Would virtual lunch and learns help? So basically, to the doctors, what would you like to see the reps doing differently?
I would say that at first is that we don't really want reps in the office. We really don't want anybody additional in the office. And so email contact, or if you have the type of relationship to text, I think that's great. I've had a number of reps from different companies. I've really appreciated the texting and emails to ask about samples, how people are doing. Having some virtual lunch and learns, if you will, for staff, I think for right now is great. But I think it's really a digital platform at present. And as things normalize, we'll see. But to really take the cues from the specific offices. But I'd say at this point in time, less contact in terms of actually coming into the office is more. It's not want to see you. We want to.
The game, a Zoom rep. I kind of want a Zoom rep more than an in-person rep, and I think that's something that the companies will have to think about, is that I might want to know that their rep, if they are going to come into our office during regular business hours, is COVID negative, and so that's one place where testing may make sense. I'm definitely going to want them to wear a mask and the like, but right now, I think most of the interaction I want with my rep is going to be, through Zoom. And I think most of us, just as Rene said, would be happy to have that interaction and help arrange it, because a lot of good education can go on that way. Matt, what are you going to do with reps?
Well, I'll say that already we've been really counting on the reps for this time. I mean, when we have team members that now, in our case, are on the clock, then we need to have ways that we can keep their saw sharp, even if it's not doing classically what they're on the team to do. And so we've been impressed by how the strategics in particular have been providing education. Lunch and learns are a good example. And then our team has turned around and done the same with area, technicians for primary eye care. So, for example, 3 times a week, we'll do a lunch and learn for techs all over the region. And
that's
I think
with the tech at home, Matt. When you say lunch and learn, they're not sitting around that lunchroom that I sit around when I come and visit. They're at home having lunch.
Yeah, but so are the technicians of our referring doctors, right? And so those doctors have either furloughed them or kept them on, and so they're looking for the same engaging activities as we are. So I think what industry can continue to provide is they have a peek into where technology is, where it's coming, what's coming next, and how to train people coming back in or who are taking a 6-week hiatus. What our team is craving is to sharpen their saw during this time, and then we can turn around and share that downstream, upstream, whichever way you look at it, to primary care. And the industry partners who have done that, and they know who they are, have been, it's been a tremendous value to us. And it's things they already have, and it's reps that have time on their hands. And nothing is more powerful right now than having a rep we're fond of call us and say, listen, how can I help you and bring value during this time? Can I just talk to your phone team on Thursday? Just them, or whatever. And I'm like, yes. please bring value. And so I think that we'll look to that in the future too, you know, even if they can't come in.
Great. So another question.
Yeah. In the post-COVID era, how likely are you to implement new technology, especially being that the focus right now is on recovery, safety, and efficiency? So are you thinking of any equipment purchases this year, for example? Or is it, are we just focused on recovery, safety, efficiency, getting back to some kind of new normal?
Rene, are you going to buy anything new in the next few months?
You know, that's going to be very difficult with funding and all of that. But I am looking at GlobeCheck. I'm really looking into seeing how that can be incorporated, because it's telemedicine. It means I can see more patients, but not have them come into the office. And I like that platform because it has all the diagnostics in one, and the patients don't have to come to the office. So that's the one thing I would consider, but it's a huge expenditure. So you have to really look at the ROI on that and see where the patients are going to come from and how that can work.
I think it's highly unlikely to see our group make any major new purchases in the next probably in the next 6 months, and so that will change. So we do expect, of course, to want to stay current, and you know, we do a lot of clinical trials, and we're expecting them to start again. We know no new technologies are coming along, but to be direct, I think it's be highly unusual for us to make a major capital acquisition in the next 6 months. Audrey, Matt, what do you think?
I think that, well, a couple of things. It is hard to imagine in some ways making a major capital equipment purchase in the next 6 months. However, as we look to the future, anything that can save us time and dictate efficiencies, you know, diagnostic equipment that can be streamlined to feed directly, you know, into other equipment for the OR, for example. And again, where we're happen to be, for better or for worse, in the throes of looking to open a new office and surgery center. And so we're really considering what we have, and again, what could help make us more efficient in terms of office systems, diagnostics, and also safer at this point in time as well. And I think it's just going to be, you know, just as you evaluate, you come up with a business plan for anything that you purchase, we're going to be taking all of that into consideration.
I'm surprised you didn't delay that new facility, but that must have been an interesting discussion.
Yeah, well, it's still, we're still, so it's probably delayed a little bit, but we're still going forward with it. We have sort of an interesting issue where we are right now. We're not going to actually maybe be able to stay beyond a certain point. So it's a little beyond us. The building that we're in, that we're renting from, they have other plans for that building coming up in the not too distant future.
So you're challenged. So Matt, you say you're running out of space, but
Yeah.
maybe you don't want to buy a new facility. Maybe you want to figure out a way to move some people out. What are you thinking?
Well, I suddenly found some space in the Seattle area for a clinic and surgery center, Audrey. So I do have a deal for you. We are in the middle of 2 ASC launches right now, and we acquired one already January 1st, so 3 in this fiscal year. So we are in full-on shoot the moon mode. You know, it's kind of like canceling a wedding in the middle of the reception. We feel like we can't really go back. So we have a lot of CapEx that we're going to be acquiring here in the next few months. And this is where I think the relationship between practice and industry is so vital. because right now I don't think anybody is at a place where they can really imagine themselves writing a check for $250,000 for a suite of whatever, okay, unbranded. But I think what we can stomach or think about is backing into, okay, well, you know, if I just add $21 per case, every case between now and the end of the year, that somehow sounds, you know, and over 5 years, it ends up probably being the same equivalent, but I think that we're going to have to play some games like that in order for the market to feel okay. And we're going to have to do it at the practice level too. We're going to have to figure out where the market is. Now, just a reminder, we've been here before. Dr. Thompson purchased the Intralace, the very first one that he got, you know, 3 weeks before 9/11. Okay, you know, in the middle of the economic crashes at the end of the 10s, we were building, you know, planning our new building and investing in new technology, and we have a rare thing that no other category has. Retail is going to get hit hard, farming is going to get hit hard, but everybody still wants to see. And even within healthcare, there is this desire to still have the most valuable of the senses. And so while we're in a tough spot, we cannot lose hope.
Oh, and we won't. We won't. So I think this was another great discussion. Thanks everyone for your kind attention. Sincere thanks to our panelists for such an interesting conversation. Dr. Preval, Matt Jensen, Dr. Perec, Dr. Rostov, and Shondo Puffey from J&J. And thanks again to our primary sponsor, Pentavision, for their sponsorship of tonight's webinars. Please let us all know with an email, you know, how we can make a session like this more useful for you. And good luck. God bless. Stay well. So, thanks everyone.
Take care,
Thanks,
everyone.
everyone.
Thank
Thank
you.
you.
Thank you.
Thank you.